Okay, let's go ahead and get started. My name is Ellen O'Connor, and I really appreciate how punctual you all are. I mean, this is fantastic. So it's 6 o'clock on the dot, and we're ready to get rolling here. So really do appreciate it. I'm the director of the Life Fitness Center. We have been running our program now. We are on year 18 is the time that we've been doing that. And throughout the time that we've had the fitness center, we have had what we refer to as the Life Fitness Center lecture series. And we've been doing this now, as I said, we have a whole bunch of topics from diabetes to aging to back care. This is actually the second or third we've done on back care. We've got other, we've got ones in Spanish. We have ones that deal with weight training, with marathon training. We've got all kinds of stuff. So we even have one from a former student who participated in the 2008 Athens Olympics. So I had a student years ago, he said to me, Miss O'Connor, I'm sorry, I missed the first 2 weeks of class. Please don't drop me. I'm going to be participating in the 2008 Athens Olympics. And I thought, wow, that's unique. That's one I haven't heard yet. So, okay, I'm good with that. So I read in the paper the next day, I read about Adam Duvendeck, and I thought, I know that name. So it turns out that he was a sprint cyclist. And so I contacted him and I said, yeah, no problem if you have to miss the first couple of weeks. However, I'd like for you to do a presentation on your experience as an Olympic athlete. Would you be open to that? He said, oh, that'd be great. I'd love to. So it's called My Road to Athens, and if you ever get a chance and you want to look at it, or you ever want to know what is it like to walk into the Olympic Stadium as an athlete in the opening ceremonies, go watch the video. So it's a pretty cool video where you walk in as if, I mean, the camera angle is as if you were the athlete. So if you want to, every time I watch it, I get goosebumps. So it's the only time I'm ever going to be close to the Olympics. So anyway, it was really nice to do that. So tonight we have a presentation that is, I think, really topical. Anybody here listen to NPR, National Public Radio? Anybody happen to hear a story this morning on NPR about back care? Well, this morning on NPR, there was a whole story on back care, and much of what we're going to talk about tonight was in that particular story, particularly around the work of Dr. Stuart McGill. So we're going to go ahead and get started. As we're doing our presentation tonight, if you have questions, please ask. No problem to do that. We will have time for questions at the end. And then I know all of you are anxious about how do I sign in? How do you know I was here? We'll do that at the end. So we'll have a big sign-up sheet for all of you. And so we'll have several of you so you don't have to wait in line too long to do that. So we'll have that ready to go. So our presentation tonight is called Train, Don't Strain, the Science of Back Health and Mindful Movement to Keep Your Back Healthy and Pain-Free. So this is near and dear to my heart. I had back pain for many, many, many years, and I just figured everybody had back pain because, I just figured that's how it worked. So as I started to learn and as I started to practice what I was teaching, it turned out that my back pain went away. And so I like to share this with people because back pain is the #1 medical complaint of Santa Barbara City College students. So in a recent study that was done by our Student Health Services program, they indicated that back pain was the #1 medical complaint. So let me ask, do any of you have any back issues, or have you ever had any back issues? Raise your hands nice and high. Yeah, a significant number of you. Anybody's back hurt right now? Yeah, same people. Okay. All right. So we're going to try to give you some information to help you reduce that. It's no fun to have pain. And the good news is you can do something about it. The better news is that you can live pain-free. It doesn't have to be that way, but you have to be conscientious about it. So the other part of this presentation is how to avoid back surgery and disc damage. So we're going to talk a lot tonight about intervertebral discs. And part of that is because what we find is that there are more and more back surgeries being performed, and over 50% of those back surgeries result in absolutely no improvement for the patient. That's not good. And so many of these back surgeries only treat a very small part of the issue. So you can see here, this is a type of back surgery that is done to provide spinal stiffness and basically lock the spine together on there. Not very fun. Anybody want that? Yeah, I didn't think so. So as I said, my name is Ellen O'Connor. I'm a professor in the physical education department, but I'm really pleased to have Peter Aguilar be presenting with me tonight. And Peter Aguilar was a physical education professor also here at the college, but he now teaches full-time in the biological sciences department and he teaches anatomy and physiology. So when I talk about these things, I think it's really important to have the expert opinion from an anatomist who spent a lot of time looking at human spines and what happens to the human spine under a number of conditions with that. And then also we have Shada Childs, who is a student intern in the Life Fitness program, and she just got certified as a certified personal trainer and is now working at the YMCA, so congratulations to Shada on that. What's also nice is that I asked Shada to put together a presentation. This was part of her internship program last semester, so many thanks to Shada for her work on this. Okay, so just quickly what we're going to go through tonight is looking at the problem. We're going to look at the work of Dr. Stuart McGill, who's considered by many to be one of the world's foremost authorities on back care. Peter's going to be talking quite a bit about spinal anatomy and things like bulging discs and strained ligaments and the things that really make our backs hurt. We're also going to be looking at some of the common postural issues and then some of the mechanics that result in back issues. And then looking at what the core muscles are. Anybody heard that term before, core muscles? Right, everybody talks about wanting to have a six-pack ab and all that, and it's a lot more than just six-pack abs. And then we're also going to look at important exercises, 3 really important exercises for spinal stability, and then also exercises that you should be avoiding because they train core muscles, but they often produce strain on the discs. And so the whole, if you don't get anything out of tonight, we want to really get to the point where we can train without straining. So we don't have to strain those discs in order to have good solid core muscles. So do any of these postures look familiar to any of you? Right, so some of you are doing these things now as you're sitting here. And what you're going to find that's kind of common in all of these is you have almost like the letter C. And what we're finding is that more and more our backs are curved, and we refer to that as spinal flexion, but they're curved in such a way that creates issues for us. So these are pretty common daily activities. Anybody vacuum? Yeah, okay, one person, right, okay. So yeah, so yeah, I do it about once a month. Anyway, so how about staring at a computer? Right? Anybody, but what about this one up here? This is the one that gets me. Right? So, or I'm in the fitness center and I'll watch students, they're riding on the bike, staring at the phone. So a lot of our daily postures are such that they're not doing us much good. And of course, you know, we all need help. And we need some reminders of that. All right, so what's the big issue here? Well, one of the issues is that our daily activities, sitting, standing, moving, sleeping, carrying backpacks, looking at cell phones, vacuuming, pushing, pulling, all these different activities that we do, we're oftentimes in a position where we're not maintaining the normal curves of the spine, of which there are 4. There's 2 forward and 2 backwards curves. So you can see that the spine is kind of S-shaped, and as Peter's going to talk about, you know, these vertebrae are stacked in an important way, one right over the other. And when we disturb that stacking by not having appropriate posture, we put ourselves in harm's way. So we're going to be talking a lot tonight about the work of Dr. Stuart McGill. This is Stuart McGill. If you go to his website, it's backcarepro.com, I think it is. It has a big mustache on it, so he's sort of known for his mustache. But he's a professor emeritus at the University of Waterloo, so he was the director of their Spinal Institute for 32 years. So he looked at a lot of research saying, okay, what are some of the reasons that our backs bother us? What are some of the causal reasons that we have back pain? And you can see his works produced over 240 peer-reviewed scientific journals, textbooks, international awards. As I said, he's considered sort of the back guru, if you will. And if we take a look at his lab, what I wanted to show you was he has a very interesting lab. And what they do in here, this is actually has a human spine specimen in it. And what they do is they take the spine and they flex and extend and flex and extend and flex and extend and try to see at what point, where does the spine fail? Where do the discs fail? At what point are we starting to see damage in that? And then what he also looks at is what kind of activities do we find in our daily lives that mimic some of those same sorts of disc straining movements. And so there's all kinds of stuff that they take from the lab into something that is, the kind of activities that we do on a daily basis, and looking to see, are these activities that are helping us, or are these activities that might be causing some damage to the spine? And if so, how might we be able to put that in a way that isn't so damaging? Is there a way that we can actually move in such a way that we're not hurting the spine on there? So we're going to look at his work and show you what he came up with on here. So again, this is how do these discs fail, and then what activities are we performing that mimic those same activities. But the most important thing here is this is evidence-based recommendations for building a strong spine. And the big thing here is without placing unnecessary load on the vertebra or disc. So we want to train, but don't strain. So in Dr. McGill's work, what they're finding is, and this has been debated by other folks, but essentially what his lab has found is that your discs have a particular fatigue life to them. So, I always think of it like a paper clip or metal. If I take metal and I bend it back and forth and back and forth and back and forth, at some point it's going to break, right? The metal fatigues and it breaks. So the idea here is that we may have discs that are somewhat similar to that. And part of that is modulated by, again, hydration. So you may or may not know that your discs take on fluids. They get bigger during the night. They sort of shrink during the day. And so that changes over time. The load at the time of the bending motion, so for example, if I'm bending like this and I'm picking up a feather, that may be very different than if I'm bending like this and trying to pick up, say, 50 pounds. Make sense? So a difference in the amount of load that's there. And the direction of the bending, I once, herniated a disc because I was working for weeks on end at a computer where my computer was here and I was typing this direction. Yeah, not real smart, right? So, I learned the hard way. And then what we take a look at is routine approach to training. So for example, what are the kinds of things that you're doing in your training program that might be putting you at risk also? All right, so this is something that I think is real important because what we take a look at here is the incidence of back problems. So 80% of all Americans, so those of you that did not raise your hand because you have not yet experienced back pain, the odds are that you will, so you have something to look forward to. All right, so the reality is that you may be someone where back pain is in your future if those behaviors are not mitigated in some way here. So proper spine function requires the vertebra to be in a neutral position. We'd like to stack them one on top of the other where they're not being jarred in any way. And problems occur when we train. So for example, do any of you do crunches or any kind of flexion type of training? Say a few hands up. Does anybody do any extension training? Right, so oftentimes we see folks crunch, 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 crunch. And that's it. And then slowly but surely, they start to become more C-shaped on that. So we take a look at opposing muscles and where they may be out of balance. Peter's going to talk about that. Posture being compromised. So if you don't learn anything else tonight, we want to keep the motto, sit tall, stand tall. Right? So in other words, we want to be standing up straight. Anybody's mother ever say stand up straight? So my mother did, and I said, I will when you do. which got me sent to my room. Don't do that. Yeah, don't do that. But the problem is that muscles weaken over time. So we sit in postures where those muscles get weakened because we're not using them in the ways that they should be. All right. So basic anatomy here, 24 vertebrae. You've got the sacrum and the coccyx. But again, what you're seeing here is that these vertebrae are stacked. And we have these two nice curves, two forward, two backwards, kind of an S-shaped curve on here. And we're going to use this term a lot called neutral spine. Neutral spine is where the four curves are maintained no matter if I'm sitting, standing, lying, or moving. So as you're sitting here right now, am I in neutral spine? No. So let's see if you can do that. So try to sit up nice and tall. Ear would be right over the shoulder, shoulder right over the hip, hip right over the knee. And, oh my gosh, can you look at your cell phone that way? Yes, you have to pick the cell phone up. Yeah, you just have to be different. Yeah, so the idea is we want to try to maintain that. Do you find that uncomfortable? Yeah, it might be a little uncomfortable. It might actually be kind of foreign. It is, I mean, trust me, this is something I deal with all the time is, oh my gosh, standing up straight. Feels good, and then I think, why don't I do that more often? Right, and then I go about my day, and before I know it, oh, stand up straight. Right, so again, this is something it's a conscientiousness thing. All right, so basically our spines do a lot of things, but what we want to focus on here is that the vertebra and the discs, they surround and they protect the spinal cord. So as Peter's going to discuss, when the spinal cord gets irritated or the nerves become irritated because the discs have been damaged and now you've got bone that's irritating the nerve or you've got fluid that's irritating the nerve, now you suddenly have pain, or you've got sciatica, which is pain running down the back of your leg, or you've got some other pain scenario that we can help you with. In other words, if you do some of these things, you may not have that. But this is a really key part of that. So 4 major postural types that we see. This one's ideal. We don't see this very often, right? Anybody have what they think is ideal posture? Yeah, maybe when we were born, right? We're pretty good then. And then, gravity takes over, right? But these are more common postures. Is there anything that you see that's common among B, C, and D? Is there anything that's common among those 3 that's different than A? Yeah, the head's going forward. And that's one of the big issues that we see is the head in each of these is forward of what's called the plumb line. So you can see the head's forward here, the head's forward here, the head's forward here. So what's nice about ideal posture is that it balances your weight front to back, side to side. And when we get out of good posture, that weight balance is disturbed. By the way, your head, anybody know how much your head weighs? 10 pounds, yeah, some a little more, some a little less, right? But about right, about 10 pounds. So you get 10 pounds off center, and now you've got to compensate for that somewhere along the way. So in this one, this is kyphosis lordosis, where you get an exaggeration in the curve in the upper back, an exaggeration in the curve in the lower back, and the pelvis gets tilted forward. This is called flat back, where the pelvis gets tilted backwards, and that normal lumbar curve is sort of diminished or eliminated. And then this is called sway back, where the lower body is pushed forward and the upper body is sort of pushed back. So we'd like to get to this, but we more commonly see these 3. All right, so I'm going to have Peter then now talk about a lot of the anatomy, since he is the anatomy expert.
Hey guys, thanks for coming. As Ellen said, this is my baby. I love talking about anatomy, but I also love talking about exercise science, exercise physiology. So the only problem is when to stop talking. All right, so I got to make sure we'll keep on task here. But what we'll do here is go through the anatomy of the disc. We'll talk about the vertebral column in and of itself. And the reason I think we really want to address this is, of course, many of you have been told in the gym, don't do this, right? Or don't do that, right? But if you want to become a personal trainer, or if you just want to be an educated consumer, an educated exerciser, it's not just knowing what to do and what not to do. It's more about why, right? You want to educate yourself. Why shouldn't you be performing this exercise or that exercise? So if you decide to tell somebody, hey, you know, I've heard you shouldn't do that, right? You should be able to tell them why, right? And again, especially if you decide to pursue careers in the fitness industry. And I know many of you are interested in that. I know a lot of you, raise your hand if you're into the kinesiology major or pursuing a degree in that end of the spectrum, or physical therapy. So these are things that you want to really put in your pocket, right, and be able to justify. It's not just about, you know, doing this or not doing that. It's about why we do this or we don't do that. Well, of course, here you can see a small segment of the vertebral column. And I've brought, of course, an entire vertebral column here. And as Ellen showed you now a couple of times, we've got 4 general curves here. And the reason we see the curvature is to actually displace weight, right? So there's really a couple of forces that are always acting on us, right? We've got gravity always pulling us into the ground. And then every time we step or interact with the ground, we have to deal with what are called ground reaction forces. And accommodating these 2 forces, or these 2 opposing forces, is really one of the major functions of your vertebral column. In between all of the vertebrae, except for the first 2, C1 and C2 up here, of course you will find these intervertebral discs. So these are little, it just look like maybe little bushings here, little pads. But these are cartilage pads. And these cartilage pads have a couple of major functions for us, as we'll see here in just a moment. But they're going to help disperse and absorb much of this shock. Again, either this weight-bearing force from gravity or this ground reaction force we might get if we were to jump and land, right? We're going to have to receive all that force through the spine. So that's where these discs come in. And just reiterating something Ellen said earlier, right? According to McGill's work, there is likely a limited life to these discs. And how we move and how we exercise can actually prolong the life of the disc. And that's what really this is all about. That's what this whole presentation is for. Well, here you can kind of get a magnification. This is a side or lateral view of the vertebral column, and of course you see 2 adjoining vertebrae. These would be in the lumbar spine, so the lower back. Of course, this is the most significant region of intervertebral disc injury, although you'll see issues at the cervical spine as well. But because, of course, the challenge for weight bearing is not as significant in the cervical spine as it is in the lumbar spine, this is where we tend to see breakdown, right? You've got to support your entire body weight in this lumbar region of the vertebral column. Okay, and of course, sandwiched there in between the bodies of the vertebrae here is that intervertebral disc. So let's take a close look at it. This is actually a cervical vertebra, but we can apply the same discussion to any of these intervertebral discs throughout the vertebral column here. And what we find is that there's really 2 major parts to this disc. So if we take a look up here, you can see they've cross-sectioned the disc, and then they've given us a magnification right here. Almost looks like cheese right there, a little brie, all right, a little dipping center, and this, you know, some sauce in the center. No, 2 parts of the disc. What we find is that centrally in the disc, we have this encased nucleus. This is somewhat of what Ellen was mentioning earlier, this watery portion of the disc. So these discs do take on water, and in fact, this central region, what we call the nucleus pulposus, is approximately 75% water. As we age, that water content will actually decrease. And so, in fact, the size of your disc will also decrease. And as many of you know, I see a few of my anatomy students in here, and Shade is one of those too, she knows that over time, what happens to us as we age? We get shorter, right? We get shorter because these discs change, right? The water content is lost, and so the disc actually loses some of its resiliency. Well, this nucleus, again, is this pulp-like gel that's located in the central part of the disc. As you can see there, usually right in the middle to somewhat the back or posterior region right there. And it's what we might think of as a shock absorber, right? A hydraulic shock absorber. So it exerts hydrostatic pressure, right? As we deform it or compress these discs, right? The force of that fluid inside the nucleus provides for resiliency, provides a bounce back effect, right? And again, gives the disc its strength or its resiliency to handle forces like compression. Again, will also contribute to our height, as we know. But the nucleus again, will take on water at night. And the reason it takes on water at night is because we lay horizontally. And when we lay horizontally, we take off all these compressive forces from our spine. And this allows then for liquids, fluid, to enter into that center, right? That what we sometimes call the nougaty center of the disc, right? Or enter into this nucleus. The disc becomes thicker and thicker. So really important, if some of you, I know we saw a lot of hands go up earlier when Ellen asked about back pain. For those of you that are experiencing back pain or are symptomatic with low back pain right now, it may be critically important for you to remember not to perform heavy, compressive type loading early in the day. Because early in the day, your disc will be larger. And because the disc is larger, there's actually an increased risk for herniation. So again, something that you might take with you in the future, right? That might be important if the low back pain gets worse or if you're dealing with clients or patients. But there is a very important quality to that, right? That as we get into the latter parts of the day, that's when we might load heavy, right? You go and do your heavy squats or your heavy deadlifts or you're doing some of your core exercises because the disc is at a better point at that time of day. Well, that's our central part. And then what you'll find right here is the real issue. The real issue of disc herniation is actually the surrounding structures around the nucleus. Well, that's the second part we'll see here. Let me bring up my next slide. There we go. Well, that's the second structure, major structure of the disc. This is actually what we call the annulus fibrosus. You'll hear us mention or refer back to the annular fibers a little bit later in this section, and this is really what we're referring to. We're referring to these rings of cartilage, and annulus fibrosus, as all my students know, this means rings of fibers. Well, what this really is, this is fibrocartilage. This is really, really strong cartilage. It's actually the strongest cartilage you'll see in your body, right? And it is designed for strength, right? It's designed for numerous compressions and distortions and all sorts of wonderful stuff. But again, we want to find methods with which we can preserve the life of this annulus fibrosus, because it's really when these outer rings begin to break down that the herniation of the disc becomes more and more common or more likely at that point. So you can again see we're dealing with fibrocartilage here on the outer part of the discs. They encase the nucleus. So I want you to realize, and I'm going to show you an image of this here in just a moment, but if these outer rings of cartilage here were damaged, torn, in other words, if I were to compress the disc, and I've got this watery center in the middle, that annulus fibrosus, these outer rings, can no longer contain the nucleus in the center of the disc. So now when I compress, that nucleus is pushed out, or in other words, will herniate out from the central region of the disc. So I do have a slide to show you that here in just a moment, but with compression, especially, you may then see the disc or the nucleus of the disc herniate out. And that's when we're going to have some real issues. And then we'll relate this back to some other anatomical structures here in just a moment as well. So there it is. When this annulus wears, that's really when we see this beginning of our disorder, our dysfunction, right? Intervertebral disc damage. Unfortunately, when these discs break down, and as many of you who have taken anatomy before know, cartilage has a very limited blood supply, and it can't heal itself. All right, so because it cannot heal itself, when you damage this cartilage or you damage the cartilage in your knee or the cartilage in your shoulder, it can't heal, or at least can't heal effectively. And oftentimes then the only outcome, right, to reverse some of these conditions is surgery. Of course, at the very beginning, Ellen showed you the fusion, right? That was a fusion surgery, but there are also, of course, surgeries that can correct for disc herniation. And I know if you're like me, you want to avoid every surgery you possibly can, right? There's no surgery, I think, that anyone would like to have. And this is especially one. If we start talking about back surgery, we're typically talking about a long recovery period. Again, recalling what Ellen mentioned earlier, oftentimes full function is never regained. Okay, so again, what this is all about tonight. How do we preserve these discs, right? How do we preserve this so we don't have to retroactively try to fix some of these issues? We do it proactively instead. Okay, well, let's just take another quick look here, and we'll have another slide here in just a moment looking at this. But notice our disc is here. Again, you're only seeing a portion of it there. And between each of the vertebrae, or through each of the vertebrae, of course, the spinal cord will pass. Okay? off of the spinal cord, off either side of the spinal cord, although they've been dissected open here, we will see what are called spinal nerves. And that's really what you might see here, maybe a little more effectively. The spinal cord probably a little tough for you to see, but if you notice on either side, we're seeing these large spinal nerves that exit a little canal, a little intervertebral foramen right here, and then make their way on to muscles and skin and other areas of your body that they innervate, right, or that they provide nervous supply to. It's when these spinal nerves are impinged or pinched that we get pain. So if we can avoid damage to the disc, we can avoid the impingement of these spinal nerves, and hopefully then, of course, prevent some of these back issues from ever developing. Well, take a look here. You can see some of the results of damage to the annulus fibrosus. If we look up here at the top, you're seeing a small herniation here of an intervertebral disc. And then if we take another view of that, what you might notice is that annulus fibrosis, I always describe it as looking like layers of an onion, right? Well, those layers are nowhere near as delicate as an onion, but with improper movement, what we can see is over time, we can slowly tear away, layer by layer by layer, these annular rings or these rings of cartilage. Again, then, when we compress the disc, if you notice here, the nucleus herniates. So if we take a look up here at some of the most common mechanisms of disc herniation, we see there's a very prominent pattern here. There's 3 primary movements that will increase your risk for disc herniation. Some of these things you're never going to get around, right? Some of these things you're going to have to do in your normal daily life. You're going to have to flex your spine. You're going to have to compress your spine. And you're going to have to twist. But if we do it in an educated way, and then in those instances where you're in the gym and you're planning to train your spine or your core musculature or whatever it is, you do it in such a way that you prevent some of these issues from ever occurring. Well, one of the first and probably most critical movements that we really want to avoid is excessive spinal flexion. You'll hear it from me a million times if you ever hang out with me that flexion is one of the worst things we can do with our spine if we do it in a particular way. If we do it in a repetitive manner, sort of in an unconscious manner, where instead of engaging muscles to support the spine, we're relying upon soft tissues, connective tissues to hold it all together and support the weight of our back. Okay, well, I'm going to show you just a little bit why all of this will really compound to eventually, again, result in a herniated disc. Okay, so spinal flexion is a big one, right? And that can result in a small focused herniation. Compression, if compression is especially displayed over a non-neutral spine, right? So again, kind of referring back to what Ellen said earlier, where these discs aren't in proper alignment, we don't have ideal transference of force from one vertebra to the next, to the next, to the next. There's an imbalance somewhere. So this force is now asymmetrical. And this asymmetrical force, accompanied with compression, can again reduce the life cycle of our discs. Okay? The other one we'll see is twisting or rotational forces. So we're going to look at all of these specific force types here in just a sec, but when we have significant amounts of twisting or what we'll call torsion force, right, that can also reduce the life cycle of your disc. In fact, we can start to see these little collagen rings begin to tear, and these aren't injuries that occur in one day. These aren't injuries that occur in 1 year perhaps, but over 5 years, 10 years, 20 years of poor technique, poor posture, right? Everybody starts sitting up, right, as soon as we say that, right? Poor posture. All of these things compound, and then all of a sudden it's too late. Okay, and now you've got that disc herniation, and we can't turn back the clock. All right, so the key again is prevention, right, and be proactive about this as much as we can. Well, as I look around the room, right, I see a lot of young faces. Younger individuals are at a greater risk for disc herniation. And that goes back to the idea of what we mentioned earlier, what I mentioned earlier about the amount of water in the disc. As we age, that water begins to decline. So younger individuals will have a larger disc, and a larger disc is at greater risk for herniation, a thicker disc. An older individual who's lost some of this water in the nucleus in that central part of the disc is actually at a greater risk for what we call end plate fracture. So the end plates are really just the top and the bottom piece of the body of the vertebra, right? And that's really what's between our intervertebral discs. Well, that little region, the end plate, again, just sort of the top and the bottom of this vertebral body, can weaken over time. And without a thick disc to help compress some of that force, more of the load is actually transferred into the bone. And so older individuals tend to actually suffer fracturing more so than they may suffer from herniation. When that happens, if you were to see something like that, and you're actually seeing the nucleus sequestration right here of the nucleus, that can actually begin to leak. But oftentimes you'll actually see the vertebral bodies will simply collapse upon one another. And when that happens, right, that may result or require a fusion surgery. Or as I was just talking to my class last week, some of you may have seen that in older, especially older women who are more at risk for osteoporosis, who display a large hump in their thoracic spine, right in the middle of their back. They have a large hump there where multiple vertebrae have collapsed, right? Because again, they don't have this nice cartilage structure, the intervertebral disc, to help support some of that weight, okay? All right, so those are sort of two common mechanisms of injury. There are other injuries of the vertebral column, but what we're really focused on is herniation, because we can seek out methods to prevent this, undoubtedly. What about creep? Well, some of you may have heard of this concept of creep, and right, it fits the bill, doesn't he? No, that's not what I mean, but I just thought, hey, if we're talking about creep, we better put a creep up there. No, we can actually now take a brief moment to talk about what is known as ligamentous creep. And many of you are actually undergoing a state or process of ligamentous creep as we speak. When you sit or stand with poor posture, your ligaments are undergoing this conformational or sort of physical change of what we call creep. And if we were to look at this simple little graph right here, what we notice is that if we maintain a constant load on a ligament over time, we see that creep, this concept of creep, increases, right? Progressively increases. What this means, if we look at creep, it's this elongation of ligaments. Now, ligaments, if you aren't too familiar with them, they connect bones to bones, right? So I'm going to show you in just a sec, but in between or along the entire vertebral column, we're going to see a whole network of ligaments. These ligaments, especially those of the vertebral column, are highly elastic. And the challenge that we really are presented with as humans is that these ligaments allow us to basically negate any kind of muscular activity to support our body weight. And we can then transfer all the force to these ligaments. All right? Over time, though, here's what happens. Right? These ligaments begin to lose their elastic qualities. Okay, a couple of studies specifically on creep. One in particular showed that after 20 minutes of full flexion, now this is exaggerated, but they had sort of a position of full flexion, right, where they had the spine completely rounded for about 20 minutes. After that 20 minutes, they found still about 50% of what we call ligament laxity or ligament looseness. In other words, they lost about 50% of that ligamentous strength or elasticity. They're just too loose. And when these ligaments are loose, we can't stabilize the vertebral column. We can't stabilize vertebrae very well. And the less we can stabilize these segments, these bones, right, the more imbalance we'll see, the more asymmetrical loading we'll see, and the greater the potential for things like discal damage. Another one you see right here, a chronic stooped posture or prolonged sitting postures actually required about 50 minutes of recovery just to achieve, or 50 minutes of rest that is, just to achieve 70% of recovery in those ligaments. Right, so those ligaments were still somewhat abnormal even about an hour after sitting with poor posture. Okay, go ahead, question?
I was just curious whether the ligaments were too tight.
It's, you know, if you saw, yeah, in a case like that, if you were to see an instance where ligamentous structures restricted movement, that would usually be due to some kind of pre-existing injury. Ligaments themselves don't change much in terms of increasing their tensile force or their strength. So that's why we usually don't focus on them if we want to increase stability, because they don't change a whole lot in terms of becoming tighter or stronger. Again, though, if you had a pre-existing injury and those ligaments became more fibrotic, right, more fibers in there that developed, then that could also sort of relate to imbalance, right? And we'd see vertebral asymmetry, and again, probably an increased likelihood for discal damage as well. So probably not very common, probably not one of the more common mechanisms of IV disc injury, but could be considered in certain cases for sure, absolutely. So what am I talking about when I talk about these ligaments? Well, just take a quick look here. You'll see there's numerous ligaments, and as I mentioned, these intervertebral ligaments, especially as opposed to many of the other ligaments of our body, are highly elastic. Well, if you think about it, right, we could rely upon these ligaments, right, and we return back maybe to a good postural position. They can sort of bounce back to their original shape. And so through evolution, right, they've adapted and have become more elastic, right, because we became bipedal, right? And as soon as we started walking, or as we started walking on 2 feet, what we find, and going back to some of the postural slides that Ellen showed you, is that our center of mass is actually in front of our vertebral column. So in other words, we are always being pulled forward, okay? So, you know, we want to know why is posture so hard? Why is it so hard to do this all day? Because it takes effort, right? Because gravity is always pulling us forward. Well, we evolved to counter that to some extent, but we didn't evolve to have healthy discs. We just evolved to be bipedal. So there's a counterplay here. So what we find is over time, some of our ligaments here, they begin to stretch. They undergo creep. And as they undergo creep, right, we can't stabilize the joints anymore. There's more movement between these bones, right, these vertebral bones. And again, we increase the likelihood of discal injury at that point. Let me go back just one step really quick as well. I wanted to just highlight this. I don't know if I really visualized this with you. We sort of talked about it on the model. But remember, when that herniation occurs at the disc, and the disc bulges or herniates out from that central location, it compresses the spinal nerve. This is really where the pain is, right? Because in this spinal nerve, you have sensory fibers for about everything, right? You got sensory fibers for touch and pain and everything else from a particular region of your body. But also, I want you to realize that not only do you have pain fibers in there, you also have motor fibers in there. Motor fibers control muscles. So not only are you going to experience pain, you're also, over time, going to experience muscle deficit, muscle weaknesses. And as those weaknesses begin to sort of accelerate over time, right, now all of a sudden you've lost muscle mass in a particular area, right? You have pain all through that area as well. And this then might just exacerbate this issue, right, and lead to more damage of the vertebral column. So really, again, what our goal is tonight is to focus on much of what we see here. These are our 3 forces I just want to talk briefly about. When I talk about a compressive force, right, we're talking about loading, right? So think about gravity as our major compressive force, and then any weight we add to our body just compounds gravity. So those are compressive forces. The disc, of course, is very adept at handling these compressive forces, in particular due to the nature of the nucleus, right, that watery nucleus. So I always think of it, you might think of it like a little indestructible water balloon, right? You smash that balloon and it bounces right back up, right, and gives you that resiliency, we hope. Okay? Other forces we're going to see, for instance, are shearing forces. Shearing, you might think of 2 pieces of paper or my 2 hands sort of shearing across one another just like this. So shearing forces can also occur at the disc. And then the last one we will also see or mention today are torsion forces. Torsion is twisting. And all 3 types, as we sort of saw on one of those initial slides there, have the potential to injure the disc. Okay? So I mentioned 3 movements to you. I mentioned flexion or loading patterns, right? Flexion, compression, and twisting. What we sometimes refer to as the triple threat. And so if we find an individual or see an individual in the gym, and I've seen it many times, right, goes in to do a deadlift, right, and they come with a flex posture, right, They're compressing the spine because the weight, of course, is pulling them to the ground, or a squat, whatever you want to think of, right? And then even though they may not be rotating to a great degree, if we've got a slight bit of torsion or rotation in the vertebral column due to imbalance, right, that puts them at greater risk. So we're going to, of course, explore methods today to reduce the effects of the triple threat, right, and try to preserve discal health, again, as best we can. This is just another representation of that more applicable version. So your compression forces, right, again, think of gravity loading through the spine. And, of course, you can see two very different lifting mechanics here. So, of course, our individual on the right, we need to put a heart here, didn't we? Our individual on the right is lifting well, and those compressive forces are being equally distributed throughout the vertebral column, right? So those curves are handling that force well. However, when she flexes, or he flexes over like this, notice the arrow right over the lumbar spine. The hinge point is about here, or the flexion point is here. So most of the force is received right in that one particular location, right? Again, rather than dissipating through the four curves of the spine like we want to see. Over here, of course, this is a shear force we might see right here. Doesn't mean it's a bad force just because it's shear. Sometimes people hear shear force, they think it's a bad thing. Again, can be a positive thing as long as we're maintaining things like neutral spine, neutral spinal posture, okay? Now again, someone has a discal injury or presents with an injury already, then we need to make some alterations. We may need to make alterations or accommodations to this. We may not choose to select all of these forces or exercises, but again, that's on a case-by-case basis. But for most of us, we should be able to handle all different types of loading, right, and still maintain our healthy discs. Well, here we have some of the most common mechanisms, right, as we've sort of seen in our previous slide. But as you'll notice, many of these relate right back to flexion, okay? So the disc must be bent, must be in a position of flexion to herniate. Let me go back just one step, and I'll start picking it up a little because I talk a lot. If we look right here, there's a ligament here that goes right along the posterior surface of your vertebra, the back of your vertebra. And when we flex the spine, we stretch that ligament, undergoes creep. Well, here's one of the issues with that. That ligament actually intertwines with your disc. So as you stretch that ligament, it actually starts to stretch or pull on the fibers of your disc, those annular fibers I was mentioning. And so in that position of full flexion, that's where we're most likely to see damage occur to the disc. So I'm going to jump ahead back to that. There it is. So again, we're herniating with flexion or full flexion. And then constancy. This idea of a concept I want you to remember, constancy. There's kind of two qualities, severity and constancy. So how severe something is that you're doing, but more so I think what you're going to be wanting to consider with all of this is the constancy of it all. Are you constantly sitting with a rounded lower back? Right? Every time you sit on your chair, are you constantly sitting like this? Are you constantly sitting with a shift pelvis? Right? And I'm looking at you, you're all kind of like, no. Right? Are you constantly rounding or, right, looking at your phone and rounding your cervical spine, which changes the other curves of your spine? Right? And again, it may not seem like much when you're doing it for 10 minutes, but if you think, I've done this my entire life, that's quite constant. Right? And so these things, again, begin to accumulate. Sitting postures, really, it's the worst thing you can do for your spine. So that's why we have you here seated. We're going to do that to you. And again, remember the older spines, right? They tend to see damage as a result of, or herniation as a result of the breakdown of the annular fibers, not as much the nucleus like we see with the younger spines. I'm just going to finish with this, and then I'll pass it back to Ellen. This was actually a great slide that Ellen pulled together and Shada pulled together. I really love this, though, this image. Back pain is a series of micro-traumas. All right, again, keep that idea in your mind that it's not going to occur in one day, right, of really bad lifting technique. Okay, it's years and years, typically, months and months at least, of poor technique, poor posture, all accumulating, right? This, again, this idea of constancy. So even these little minor injuries, they start to add up, right? You have this continuously poor posture, right? They add up. You've got this weakened, vulnerable spine, vulnerable disc, and then the last little thing, like, oh, how'd you hurt your disc? Right? Oh, I was coughing. oh, right? Like, no, that was just the last straw, right? And of course, the metaphor is the straw that broke the camel's back. Well, the camel's back has been breaking down for years, right? There was just one final straw that broke it, right? That one final straw that caused the herniation. So our goal, of course, is to prevent these micro traumas, prevent this accumulation of injuries over time, and really try to incorporate the health of the disc as much as we can. This is a slide my last one I'll show you that I like to show in my anatomy class. I always give a joke that this is me sleeping, and I'm snoring, and my wife is like, right, gives me one of those and kicks me over to my side. And look what she did. This is intradiscal pressure. Laying on my back, now she kicked me over and I'm laying on my side. She just tripled the force on my intervertebral discs. Right? Isn't that selfish? It's just so rude. So I'm actually one of these people that snores on my side, right? So I'm still snoring. And then she kicks me out of bed, right? So I'm up. No, I'm up. This is me, right? But standing with poor posture, right? I just doubled that force on my disc once again. Right? Just standing with poor posture. So I want you to compare and look at some of the differences here. Standing with a good neutral spine versus standing with a poor flex posture, right? Significantly increased stress on those intervertebral discs. In fact, standing with a poorly flexed spine like this is about equivalent to sitting with good posture. Of course, sitting is the worst position you can be in because you don't have your legs to dissipate some of the forces that you'll find of course, traveling across your spine. It is all basically now isolated at your lumbar spine. It's going to, of course, you'll carry all your weight. And then you sit with a slouch posture. So this is most of you, all right, right now. I'm not going to call anybody out. Maybe I will. But then you bend over to pick up your backpack. Right, this is equated to about a 20-pound weight right there, some of your backpacks. Right, and that's where they were able to measure the highest measure of intradiscal pressure. Instead, you want to bend over, you're sitting, you want to bend over and pick something up, stand up and do it, right, properly, or at least try to maintain a neutral spine as you do it, and that will help preserve the life of the disc. And we'll talk more about that as we go. Here we go. I'm going to hand it back over to Ellen for postural tag.
So this is a little bit of audience participation part here. So I love this slide, though, because it really sort of gives us a good visual of how we've progressed or maybe haven't progressed over time. So have any of you heard the term bracing? Right? Bracing, anybody heard that? Right. So like we brace for impact, those kinds of things, hopefully not in a plane and that sort of thing. So here's the deal here. Bracing is where we can create stability for the spine. So here's what you're going to do. Take your fingers, put them on the sides of your body, and what I want you to do is pretend that the person next to you is, tries to punch you in the stomach. So what would you do if they tried to do that? Right? Would any of you tighten up? So that's what bracing is. So imagine this. Someone's going to punch you in the stomach, and what you do is you brace for that impact. So try that. With your fingers at your side, brace. So let's try that. So we're relaxed. And now we're going to brace. And can you feel the muscles activate? Right? You should feel some tightness there at the tips of your fingers. So the idea here is that we want to give the spine some stability, and we want to give it some stability so that it can function the way it's supposed to function. And so the idea here is we want to be in that bracing mode most of the time. So bracing can be modulated, or it can be like a little bracing when I'm walking, and we're going to talk a little bit about walking, or more bracing if I'm lifting, and I want to stabilize that spine. So as you're sitting now with your good posture, try to engage in that bracing. And in 5 minutes, I'll ask you again if you're bracing, because we all forget, and we don't do it here. So make sense? So in lots of the exercises we're going to talk about, we're going to use the term bracing. So we want to precede the exercise or the movement or the activity with bracing, because bracing helps to stabilize the spine. Okay, so Peter's going to talk about one of his favorite things called setting the scapula.
Yes, and Again, I know I see a lot of familiar faces. Some of you have taken my anatomy course, and this is something I teach to all of my anatomy students because I'm there lecturing, and I'll look up, and it's, I teach a night class, right? They're like, oh, Aguilar, come on, right? I'm like, this is horrible, all right? We're all going to change our posture right now. So I want everybody to practice this simple fix with me just quickly. So just put your arms down on the side, just kind of shake them out a little bit. And what we're going to do is actually seat the scapulae. So you're going to seat your shoulder blades in a better position. And what we find is that when we are better able to do this, we will naturally then translate those forces into all the areas of the spine. So we're not really, for the most part, moving the spine. We're moving the shoulder blades. And why this becomes such an issue is because we see that the pectoralis muscles, for many of us, and remember that idea that your center of mass is in front of your vertebral column? Tight pectoral muscles and a center of mass in front of the spine pulls us forward. It pulls us into a kyphotic or hunchback posture, and also what we call anterior shoulder roll. Okay? So a simple fix we can do, everybody do this with me. We're just going to go up with the shoulder blades. We elevate. And then we're going to go back. We call that to retract. And then we're going to go down or depress. So try it one more time. You're going to elevate, retract, and depress. And when we get into this position, I want you to think, and maybe I'll borrow Ellen here really quick. I want you to think, I'm just going to turn you this way. When she gets elevate, retract, depress, she gets into that bottom position, she wants to feel a little bit of an activity here, right? She wants to utilize some of those postural muscles between the shoulder blades to help support her weight. Okay, then we got one more piece to the puzzle. So elevate, retract, depress, and now you're going to rotate your shoulders outward. We call this external rotation. Now you can't stand like this. You're not going to walk around like this, right? So once you externally rotate, then just relax the forearms. But we want to try to maintain that good scapular position of the upper back, right, or at the upper back. Now, I didn't tell any of you to sit up. I didn't tell you to do anything to your vertebral column. We just moved our shoulder blades and moved our arms. But look at everyone in this room. Every one of you now is sitting up straight, okay, because we translate this force from the thoracic spine down to the lumbar spine. So here's the weird part, right? When you first do it, elevate, retract, depress, you're going to walk like this, right? And you got to learn, we just have to learn to be able to hold that and still produce natural movement, right? You can still get your strut a little bit if you want, right? But still try to maintain good activity, good muscular activity in those scapular stabilizers.
Excellent. And by the way, from here, way better posture, what we're seeing. So with that little movement, much, much better posture. So arms folded across the chest. Any of you stand like that, right? So we oftentimes see arms folded across the chest. Peter was just talking about our center of gravity is in front of us. Now I put more weight in front of us. I end up more rounded. So an easy fix. Shada's been standing that way now for a better part of an hour. Hands behind her back. How's your back feel? Great, yeah. So it's an easy fix, right? Hands behind the back is an easy way to help shift that weight again. Again, Peter's going to talk here about the sitting posture.
You know, I don't think anything magical here, but sort of what we've been referring to all along. We're sitting with this slouch posture. Again, over time, this constant load on those ligaments will create a constant effect or an effect on the annular fibers of the disc, and we may begin to see premature breakdown. Unfortunately, you live in a wonderful time, but you also live in a time where we are more sedentary than we've ever been in our history, right? If you think about 20, 30, 40, 50 years ago, at this age, you may not be sitting in a college classroom, right? You may be working in a factory or doing some other kind of blue-collar work where you're on your feet all day and you sit in a very sort of limited amount of time. So because of that, we have to sort of accommodate or adapt to this lifestyle. And again, this slouch posture over time can break down the disc. So with that seated posture, what we see is that your pelvis will rotate to the posterior, thus, and I'll just show you here, rotate to the posterior, and when I do that, you might notice that the lower back flattens. I kind of bent some things, but the lower back flattens a bit, and now again, you're not distributing those forces equally through that lumbar region. Remember, this is the area of the spine that takes most of our weight, especially when we're seated. So if you are seated, what we of course want to see is that nice neutral spinal posture position. So seating the scapulae can be one solution to that. The other solution, or the other piece of that puzzle, is to maintain a slightly arched lower back. Well, you're not going to overarch. What we're really trying to emphasize here is just maintenance of our lumbar curve, right? And the other last little bit with this, we'll talk about what is an ideal posture. Ideal posture, there's a few things that we'll throw at you, but keep in mind that you should be moving, right? You should not try to maintain this position for an hour and a half, right? You should maintain this position for 10 or 20 minutes. Get up and move, right? Then sit back down with your good postural positioning, because if we have a constant load, that's really a recipe for disaster. So change your position.
Yeah, absolutely change your position. Okay, so we're going to do a little practice here. So this is a really good way. Any of you sit at a computer for any length of time? Right? Back probably bothers you and you find yourself slumping over. Easy way to help relieve some of that is, and you can do it right now as you're sitting, is to go ahead and as you're sitting, is simply hands up over your head and palms facing the ceiling. How's that feel? Does that feel pretty good? Yeah, so you can elongate that spine. Now, when you bring your arms back down, up, around, back, right, seat the scapula. So getting in and out of chairs. So one of the things we're going to talk about tonight is what's called the shortstop squat, or basically hip hinging. And so I use this a lot. I try not to sit as much as I can, right? I try to move about every 20 minutes. But in terms of going from sitting to standing, hands on the knees. Now I'm in a bit of a squatting, hinging position here. I can stand up, and then I reach up nice and tall, elongate the spine. Feels great, right? And so it takes a lot of that pressure off and allows you to really unload a lot of what happens as we sit, particularly if we sit in a poor postural position with that. If you're sitting at a computer and you're sitting there, raise the arms over the head. Really makes a big difference in terms of trying to unload that disc. And you can see great posture on there. So now we go to what's called the hip hinge. And this is a critically important move that we need to learn, we need to master. If you listen to NPR this morning, this was exactly what they were talking about, is hinging and using the ball and socket joint of the hip to perform movements that we oftentimes get lazy and then do this. Okay, so Peter's going to tell you about a hip hinge.
That's exactly right, Ellen. And this is sort of the answer to these poor techniques that we have for our daily activities, right? So reaching down to tie your shoe, right? And starting with that flex spine, or reaching down to pick up your kid, right? Or a box or your backpack or whatever it is. The more we can get into a habitual pattern of this hip hinge, the more load you take off the vertebral column, the more load you take off the discs, and we then maintain that load into the musculature. One of the most powerful muscles in your body, and the largest muscle of your body, is one that many of us don't use effectively. Gluteus maximus, right? And gluteus maximus can really share this load with your spine. In fact, take much of the load off of your spine. And that's where this hip hinge really comes in. The hip hinge is something you can apply to exercise. It's really a modified deadlift is what he's doing here. And the hip hinge is designed to favor the gluteus maximus musculature and other muscles as well to drive movement, right? To drive these movements where we might pick things up and again take the load off the soft tissue. So really what we're looking at here, a shortstop squat, you'll just start with the hands flat on the thighs, just like so. And as McGill will, this is McGill again right here, if he were directing this, he'll tell his patient to just slide the hands down the thighs, down the anterior thighs, until you get to about the knee, okay? So about right here. And the key with that was that I never changed the position of my vertebral column. The only thing I'm doing, as Ellen mentioned, is I'm taking advantage of the hip joint. This becomes now a hip-dominant movement and not a vertebral-dominant movement. So I'm here. I can reach down, pick up a kid, pick up a box, whatever it is, and I can drive with the gluteal muscles and the hips instead of putting all that load on those vertebral bones, discs, and some of those muscles as well. The other key with this is that not only are you taking the load off the spine, you're also taking the load off the knee. So raise your hand if you have knee problems. Anybody here? Yeah, exactly. So really we're going to see lots and lots of back problems and lots of knee problems. And as these muscles weaken, as these gluteal muscles weaken because we don't hinge effectively, what we tend to favor is what we call a knee dominant movement. Right? So now you go to pick up your kid and you come forward like this. Right? Now I can keep my back straight, but look, I'm translating all that force into the knees. Right? Instead, I want to translate that force back into the hips where all the power is, where all the musculature is. And I think that goes right along with our next slide as well. This will differentiate the hinge from a squat. Now, both are effective and great movements, but they train joints differently. They train musculature differently. The hinge is what, again, we call a hip dominant movement. This is where we're going to see, or should see, the greatest power that you can produce because you are really isolating or utilizing the most powerful muscles of your body, right? The gluteus maximus. Over here is the squat, which is actually what we consider a knee dominant movement. Again, both are effective, but you might notice, although he is exhibiting neutral spine in both positions, the body angle is very different, right? So the body angle on the hinge is here. Notice how I have a much more forward body angle. So I might have a weight here or a barbell, right? I'm doing a deadlift, whatever it may be, is a much different body angle. So there's our hinge again, than what you might see with a squat, which might be here. Okay, both again can be effective, but in daily activities, right, as we're bending over to pick up things, the hinge is more likely a more functional movement for us. Right? Many of us, now some of us, we may squat down to pick things up. That's great. But the hinge can be something we use to tie the shoe. The hinge can be what we use to help pick up the kid. Right? And you can show variations, right, where one leg might be forward, but I'm still hinging at the hip and utilizing the musculature, taking the load off of our soft tissue.
So let's go ahead, before we do this,
Love that guy.
let's go ahead and have you stand up and try the hip hinge. So you're going to come up out of your chair. Now remember, if I stand up, right, I can unload the spine. Very nice. All right, so why don't you take those hands. So hands go onto the thighs, slide them down. I'm going to hinge at the hip. Head stays up. Eyes are forward. How's that feel? Thumbs up, good. Thumbs down, not so good.
Sure. Try it again. So, you know, to make it simple, you may also think butt back, right? If you notice when I move, my knees don't go forward at all, right? There's no forward movement in the knee. It's just butt back. All right, I bend the knees slightly, but it's just a butt back position, okay? You're going to see in just a moment, then there are other activities, right? Think about when you're standing over the stove cooking spaghetti, right? You got to lean it. We'll taste some of the sauce, right? Little hip hinge versus a flex spine, which we tend to favor. And again, over a life cycle, this is where things begin to wear down over time.
Okay, so we're going to go through some of these others probably a little quicker here. So this is, do any of you walk? I mean, obviously for like exercise. Yeah, sorry. As soon as it came out, I thought, well, that wasn't good. Yeah, so, sorry. I heard it too. All right, but thank you for being awake enough to be able to recognize that. So we see this kind of walking posture all the time. Head is down, rounded, probably finds a lot of money that way, right? So that way you can, but you can also see that his arms are really stationary. And this really loads the back and it loads the spine. So as you're walking, we always recommend being able to walk and really swing your arms. And as you swing your arms, what you're going to find if you were to do an EMG on the core muscles is that those muscles actually get activated. And they get activated to help support the spine. So we always want to stand tall, head is up. I usually try to tell people, look for the exit sign, right? I can't see the exit sign this way, right? So I used to try to work with my father as he was aging and his posture was getting poorer. Head down, I said, remember, Dad, look for the exit sign. And that means I have to look up and to be able to see that. Okay, another easy technique for lifting is the golfer's lift. This is a really good one.
Essentially, guys, what this is a one-leg hinge, right? This is really a stiff leg deadlift, as we call it. But it's really, again, just translating this idea of the hinge to daily activities. So you may not go down with both legs, right? Hinge down to pick things up. You may just want to go and pick up a golf ball, of course, what this is named for, or your water bottle or whatever it is. And so here you can simply hinge at the hip and rotate back up, right? So I'm just rotating here down and then rotating back up, right? Instead of sort of the classic, which is flex down and extend up, right? Again, over the years and years of this, breakdown will occur. So a simple technique, and this, of course, is a great exercise in the gym in and of itself. We put a dumbbell in one hand, and we train these hip hinge mechanics, right? And really get into the gluteals and the hamstrings that way.
Excellent. So I like to show these because, you know, we think about exercise all the time, but it's our daily activities where we can practice these techniques. So I know many of you probably have children at home, or you have, you know, weights that you want to pick up or something else that you want to pick up. And you can see this is a really great, you know, hip hinge here. Look at the ear. There's a nice straight line between the ear and the hip, and then a nice line between the hip and the knee. Or brushing your teeth, right? Instead of hunched over the sink, is to be able to hip hinge where you've got that nice line between the ear and the hip, and then between the ear and the, or excuse me, the hip and the knee. Sometimes I'll put one hand here to remind myself to hip hinge. And that's a good reminder for me to be able to do that posture pretty well. Easy way to tie your shoes. Bring your foot to you, as opposed to this, right? So be able to hip hinge and tie your shoe.
Instead
How
of
many
this.
of you wear slip-ons? Right, then you don't have to deal with that, right? That's the other technique. Or don't wear shoes, right? So not tying your shoes on here. Okay, just quickly here, pushing and pulling. I know a lot of you do that sort of thing, and particularly if you are, we showed you a slide earlier, vacuuming. So for example, if I want, you know, lots of times we vacuum this way where the weight is to one side as opposed to, we usually try to have that, here, can you fix that? We usually try to have the navel so that the weight is right at the navel. So if I'm pushing something or I'm pulling something, the end of that would be right at where the navel is. And so that allows me to keep the weight centered. Remember, I'm bracing. Anybody still bracing? Okay, well, let's do it again then. So brace, right? So we want to make sure we're bracing as I'm back and forth and I'm moving that as well. Okay, what do we got next here?
I think I'm up.
All right.
We're going to talk quickly about 3 systems as they relate to the core. I know probably a lot of you are here like, okay, enough of this, right? Tell me what to do in the gym, right? Well, first, let's just look at the musculature that comprises the core. The core itself is sort of an enigma. There isn't really a core. It's all this intercommunication between muscles that surround the vertebral column, muscles that help to move the vertebral column. But then we also have other muscles that attach to appendages that also we can really consider part of the core. And this transition or translation of forces through the core are really what we should be more concerned about. Not so much muscles, more so movements. But when we look at this, we want to really show you this hierarchy. There's really 3 levels of musculature here. And the first group, whoops, let me go back, there we go. The first group are what we call the intrinsic muscles of the core. Or if you're familiar with NASM, National Academy of Sports Medicine, they refer to these as the local stabilization muscles, or the muscles of the local stabilization system. When we think of these local or intrinsic muscles, what we really want to think of are deep muscles that for the most part you really will never see, right? These are the muscles that are going to directly stabilize your spine. With that in mind, let's just take a quick look here. Some of the major intrinsic muscles of the spine are a deep muscle here called transversus abdominis. It's one of actually the deepest muscle of your abdominal wall here on the lateral and posterior parts. Your diaphragm is actually part of this group, and in fact, diaphragmatic training is a big piece of this puzzle that's left out in a lot of programs, but becoming kind of a new phenomenon. Another muscle group here, or group of muscles, called the multifidus, or multifidi. And for those of you that might go into PT or personal training, you will likely come across information that shows that in those individuals who have back pain, right, the 80% of Americans who have back pain, about 80 to 90% of those show a dysfunction in this particular muscle, multifidus. And so it's definitely been a target for physical therapists training this muscle or muscle group to help stabilize the spine. Last are the muscles of the pelvic floor, your Kegel muscles, or PC muscles as they're also called. They stabilize your pelvic floor, but that can also translate into better support for your vertebral column. These muscles are difficult to train, but all can contribute to stability. So if we challenge the stability of your spine, we try to take you out of this neutral position, we're going to activate these deep muscles. So that's what many of our exercises will do for us today. What we find, again, they're going to provide segmental stability, so stability between vertebrae. I'll get you one sec. They're going to limit force or excessive force, provide stiffness. But a big key to this, and a big key of what you're going to see with a lot of these core muscles, they are what we call slow twitch muscle fibers. They are designed for endurance. They are not designed to be using 20-pound medicine balls to do 5 repetitions. No. They are designed to fire and be active for an entire day or an entire sporting event or whatever it is. All right? Whatever demand you place on them, their function is to be active during that entire movement. Question over there. Go ahead. Why is it so easy to pull them? Because I would say in most cases because they're so excessively weak. This is not a group that most individuals will train. You may be training these muscles if you've been told to train these muscles, right? If you are a woman who's had a baby or is going to have a baby, you might have been told to train these muscles. Or if you are trying to improve bedroom lifestyle and you want to try to do your Kegel exercises, right? That might be one impetus for training these muscles. But beyond that, there is no pelvic floor machine in the gym, right? Thankfully, because it'd probably get a little messy if it did. So that's why likely these tend to be very weak. In fact, if you really want to train these muscles, simple way to think of it, think of the muscles you use to stop urination. Okay? So everybody just go ahead and pee a little. And then stop. No, just pretend, right? And then activate those muscles. So you want to sort of feel that contraction of the pelvic floor in these muscles. And if you do this correctly, that contraction will actually translate up into the multifidus. In fact, it's one of the best ways to strengthen the multifidus is to strengthen these pelvic floor muscles. Well, I'm going to keep going so we can get through and talk about some exercises here. We then get into our global stabilizers. So local stabilizers, deep, we don't see. Global stabilizers, some of these are your mirror muscles. These are what you might consider your core muscles. Okay, so these are the larger muscles that provide support and stabilization to the spine. And again, these are more external or superficial. They attach to the pelvis and the spine, as you can see here, and they help to transfer load. So in transferring that load, they're going to take the brunt of the force off of the vertebral column, and it will be translated into this musculature. That's really what we want to see. That's why you're here tonight. Our last little bit, right, they provide stabilization and control to the core during movement. So if you're doing a throwing movement, right, they prevent over-rotation. Or if you're doing a pressing movement overhead, they can prevent things like hyperextension. Or if you're doing a squat, they can prevent things like hyperflexion. All right, this is really where we should be taxing these muscles. We should be taxing them through functional movements, through loading type movements. But the old idea of doing hundreds and hundreds of crunches is probably not the most effective means to train these muscles. It's not really what they're designed for. All right, our last group we'll see right here, and there's just some additional pictures there, cadaver pictures, images there of, for instance, our global stabilizers of the washboard, right? Rectus abdominis, the external obliques, the internal obliques, which you may see there a little bit. And I don't have a posterior picture, but the extensors of your spine would also fall into this category, the erector spinae muscles. There's our cadaveric images, and the last little system we see is the movement system. So these are then the muscles that coordinate or work with the core to then produce movement, right? And it's only through activation of these muscles and translation through the core, effectively, that efficient movement will be produced. So we can see these are the muscles that are attaching to the spine, the pelvis, the legs, and the arms. Remember I said the core is not just this, right? The core is here. The core is here at the attachment of the lower appendage. The core translates here at the attachment of the upper appendage. So your hip joint and your shoulder joints are also part of the core. And if we can translate force better into or through those joints and then produce our movement while stabilizing and producing neutral spine, again, we can maintain a healthy back. So there it is. They produce that deceleration as well to help prevent unwanted movement. And they can also then provide stabilization support as well during different kinds of functional activities. Just some examples: latissimus dorsi, big muscle of the back, of course. Your hip flexors, which tend to be hyperactive in many of us. Hamstrings, gluteals would also be in this group, as well as your quadriceps. These are the big movers. But again, we can all consider this part of the core. You can see some of our images there: latissimus dorsi, hip flexors, hamstrings, gluteals, and our quadriceps as well in that movement system. All right. I'm ready to hand back over to Ellen. Let me go back for you. There you go.
Okay, I just want to show one thing real quickly on here, that this muscle right here, so we've got psoas major, and we oftentimes refer to these as the hip flexor. So we're going to talk about some exercises tonight that are what we call contraindicated exercises. It means they're exercises that we really probably should avoid. And one of the reasons is you can see how these attach onto the lumbar spine. And when they're activated in certain types of ways, they pull on that lumbar spine. And so they provide additional stress onto that. That make sense? So we're going to talk a little bit about when we say hip flexor dominant, there are some exercises we want to avoid, and it's because of this impact right here, where they attach and how they tend to pull on the spine. Would that be a decent way to explain that? Absolutely. All right. So finally, what are we going to do? So what we're going to present to you here, these are exercises. We're going to show you some demonstrations here. And because we're all sitting in a lecture hall, we can't work with you individually, but we can in the fitness center to be able to do that, is to help you with mastering some what we call the big three exercises. These are exercises that activate the muscle groups that Peter just spoke about to provide stability to the spine, but they don't flex and extend your spine, which produces disc damage. Make sense? So we can train without straining. Let's see, I got word that not everybody got a handout. Who's missing handouts? Okay, are there extra handouts? Excellent. This would be the audience participation part. You could actually walk them down here. Remember, we've got to move about every 20 minutes. So feel free to do that. Anybody else have any extras? Okay. So a couple of things here that are on your handout. So Peter talked about these muscles. We want to train them for endurance. So it's not doing massive number of repetitions, but repetitions we hold for about 10 seconds. So this is what's referred to as a descending pyramid. So in each of the exercises we're going to tell you about, you're going to do 6 repetitions where you would hold it for 10 seconds. I hold for 10 seconds, I relax. I hold for 10 seconds, I relax. I hold for 10 seconds, I relax. I do that 6 times, and then I pause for 20 seconds, and then I go to the next set. 4 repetitions. Hold for 10 seconds, relax. Hold for 10 seconds, relax. Hold for 10 seconds, relax. Hold for 10 seconds. I wait for 20 seconds, and then I go to doing 2 repetitions. So I start out doing more, and then I do fewer and fewer of those. So these are really fantastic because they don't flex and extend, and they spare the disc. So we'll show you those big 3. And we want to perform these usually not right when you get up, so usually later in the day is probably a good time to do that, right, because the discs have reduced some of their fluid. And we want to start with a few repetitions, gradually progress. So if you have pain in these, back off, do fewer, or hold for less time. All right, are we bracing? Okay, so remember, we want to keep bracing. So again, turn to the person next to you and pretend you're going to hit them, and then they'll brace, and then we'll be in good shape here. Please don't hit them. All right. And so what we want to try to do is always create a spine, that can move but isn't in pain. All right. So these are the big 3 exercises here. This is going to seem really strange because you're going to say, well, these don't seem, they're not aggressive enough. And they really don't have to be. That's the secret to this, is that they really don't have to be. So the big 3 exercises are referred to as the McGill curl up, the side bridge, and the bird dog. Peter just talked about multifidus, long muscle on the back of the spine. It's an extensor. This is a fantastic exercise, and we'll show you some variations of that, but really a great. Do any of you do these exercises currently? How many of you do, we'll show you the curl up, but do any of you do side bridges? Fantastic, great exercise. How about bird dogs? Good. McGill crunch, this may be kind of new to some of you, so we'll show you that. We're also going to show you some exercises, and on the back of the handout, so there's 2 sides to the handout. One side is what you want to do, the other side is what you would like to avoid. And again, the avoiding is because they have been shown to, with repetition, create damage to the spine or strain the discs. And again, we want to avoid that. So standing seated slouch posture, so as Peter talked about, standing slouch or sitting slouch, or we see this in the gym quite a bit, right? I want to work on those biceps, so there I am, I'm hunched over, and I'm working those biceps, but I'm straining my spine. So oftentimes I'll say to someone, let's get the shoulders back, let's stand up. What? I can't do as much. Yeah, it's harder. You have to use more bandwidth to stand up straight. Makes sense? Same thing, bicep curls, right? We want to stand up nice and tall. So we want to have that good standing posture, whether seated or standing. The knees to chest stretch is one that really can create damage for the spine. And then toe touch stretch, which we talked a little bit about earlier, and we'll show you. And then sit-ups, again, we'll go through these as far as difficulty with that. Okay. I'm sorry, Peter, I'm going to try to move us along here. All right, so here's our curl up. All right, so in this curl up, there are 2 things here. So you can see this one is kind of a no, and this one's kind of a yes. And the reason that one's a no and one's a yes, see how he's curled here? There's that C posture. So this is out of McGill's lab, and you can see that there are electrodes on this individual, and they're measuring the activation of the muscle as he performs this activity. It turns out when you keep your head back and you keep this lever nice and straight, there is greater muscle activation. Your muscles have to do more in order to create this exercise. So we want to keep from having the spine curled here. So this is what it looks like. The hands are under the palm, under the lower region of the lumbar with palms down. The abdominal muscles are braced. So again, we want to continue to brace those muscles. The head, neck, and shoulders are going to be slightly raised off the floor. The nose points to the ceiling as we do that. And it looks like this. Yeah, it actually worked. So she's going to hold for 10 seconds and then she relaxes. Doesn't that seem like really easy? So the question is, it is pretty easy, but would you do it for 10 seconds and to be able to hold that? So let's do this. We're going to have Shada, excuse me, she's going to demo right up here. So sorry, we don't have an area here. So she's going to, be right in front of you there. You're okay. Yeah, we're going to use the table here. So the exercise table. So here's what it looks like. She's going to go ahead and hop up on the table. And she's going to put her palms down underneath her lumbar spine. She's going to lie back. So one knee is bent, the other is straight. And all she's going to do is exhale as she comes up, and she's going to bring that nose towards the ceiling. She's going to hold it for 10 seconds, 1, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010, and then she's going to relax. Probably 1, 1002, 1003, 1004, 1005, and then she's going to do it again. She's going to go ahead and come on up. All right, so she braces first and then comes up. She's going to hold it for 10 seconds. And then back down again. Does that make sense? So she's going to do that 6 times, and then 4 times, and then 2 times. And then she's going to switch legs. 6, 4, 2. Make sense?
The other important piece there, too, folks, is the hands under the lower back is to ensure you're not rounding the lumbar spine. And so it's just a cue for you. And so if you feel you're starting to round the lumbar spine, you flex too much, right? You've come up into that C-shaped posture that Ellen was mentioning. So that's why we put the hands under the lower back. Yeah. Here we see the antithesis of this, and really what we should not do. And of course, this is your traditional crunch. And the bicycle crunch you'll see on the left here, well, there's a couple of issues with this. Of course, you notice sort of what we were just mentioning there. The reason we have our hands underneath that lumbar spine is to limit lumbar flexion. Remember, again, these aren't things that occur in one shot. These are things over reps and reps and years and years. So with continued repetitions with a flexed lumbar spine, we're wearing down the disc. Over here, same idea. Now, there's a couple problems with this image. Of course, a rounded lumbar spine. We likely also, when the legs begin moving into this position, we'll see a transference of force from your abs to those hip flexors that Ellen was pointing out to you earlier. And so you'll still feel effects here, and that's why people continue to do these exercises. No, this is for my abs, right? This, I feel it. Well, in fact, it's actually a hip flexor dominant movement. But the abs are working somewhat isometrically, so the abdominals would still work, but unfortunately they're not taking the brunt of the load. The hip flexors are, and those hip flexors then are pulling on that lumbar spine. Of course, the other issue here is neck, right? And you see significant cervical flexion, especially with a force. So if you are ever going to perform an exercise like this, at least if you do it, don't pull the neck, right? You keep the fingers at the ears and maintain good cervical spinal position, because we can produce herniation in the cervical spine just as much as we can produce it in the lumbar spine. But again, we have our McGill crunch is a better alternative to both, undoubtedly. Here are other options, right? This is the traditional sit-up, and we hope that, the word has spread enough that people are going away from sit-ups at this point, because these are hip flexor dominant movements. And on the next slide, you'll see there's a reference to this idea that if the feet are fixed, if the feet are locked into someone's hands or in a device, the emphasis has now been flipped from the abdominals to the hip flexors. It now becomes a hip flexor dominant movement. Again, your abdominals will work, and that's why people continue to do these movements, right, even though they're improper, because they'll feel something here. But again, the overall stress is displaced to those hip flexors. Notice, of course, the top position of our sit-up here. I think you all notice something, a few things wrong with this. Flexed lumbar spine, a flexed thoracic spine, and now likely pulling with force onto a flexed cervical spine as well. So there's multiple things wrong here. The straight leg sit-up, as we see right here, even worse, right? And in fact, McGill did some research looking at the straight leg sit-up, this position in particular, and found some of the higher loads on intervertebral discs in that position. So when we fix the feet, and maybe if you want to show the next slide, Ellen, I think this is a great one because you're seeing some exercise programs now that actually incorporate this type of movement, and they might even go back into excessive spinal extension. You're actually exacerbating the risk for discal injury, but also other types of injury at the vertebral column, fracture of intervertebral bones as well. So we lock the legs, right? It becomes hip flexor dominant. You're no longer training the core, right? You're now training that mover or the movement system, but there are better ways to train these hip flexors, more functional and effective ways without, again, placing undue load on the spine. Again, same ideas here. When we do our leg lifts, right? Although the legs aren't fixed, this is really a movement of this is hip flexion, right? The abdominal muscles, if we were to train those for, in other patterns, right? They're not hip flexors. They are vertebral flexors and pelvic tilters, right? They tilt the pelvis, they flex the vertebral column, but they do not drive the movement of hip flexion. So again, there's a big error in training when we select exercises like this for the abdominals. Even though you might see these in magazines or you might see these touted by programs, they again are just showing you the what, but you're learning the why. This is why you don't do this, right? Because again, undue load on the spine, undue load on the vertebral column here.
I oftentimes have students and they'll say to me, why does my back hurt when I do leg raises? Well, because it's pulling on that lumbar spine. It's taking that vertebra and pulling it out of that neutral position.
And I think really the reason that individuals will seek these exercises is because they can do them, right? They can do large numbers of repetitions or large amounts of weight attached to their limbs or attached to their legs, whatever it is, so it looks good, right? But it doesn't look good on the inside, right? It's not training the musculature appropriately and optimally.
So some good alternatives, and I'm going to have Cheta again demo this. This is called a dead bug exercise. I'm not really sure why, but okay, that's what we call it. So on this one, you'll notice that when the exercise is done, the spine stays in a neutral position, no load, but the core muscle, particularly the flexor muscles and those that are responsible for stabilizing that, they get activated. So the way this works is I usually have people start with knees up and hands on the knees because it's a little bit easier to figure out if you're directionally challenged like I am, opposite, which one am I doing? So we usually start with knees up and then hands on the knees. And then in this case, she's going to go with opposite arm and leg extended. So she's going to extend, she's going to extend that leg here, and you don't need to cross the hands. And then she's just going to alternate. So, yeah, just like that. Make sense? Can you feel that? Yeah. So as you do this exercise, you'll feel those muscles activate. But you can see that the spine is being supported and the spine is maintaining its neutral position. Anybody ever engage in this exercise, dead bug exercise? Yeah, this is a really good one. This is a really good exercise on there.
They don't always look as good as they feel.
Yeah.
Yeah.
But the other thing, some of you may say, well, wait a minute, we just said we don't want to do a leg lift. Isn't that part of it? In this case, the knee is bent, and so we're not lifting a straight leg, and so the load is significantly reduced on there. So that's how we get around that. Okay, rollout exercises. Peter's going to talk about. These are also great exercises.
If you haven't noticed, many of these exercises involve positioning the vertebral column isometrically. And then you challenge the limbs, right? Then we move the limbs possibly. The rollout is one of the best examples of this. So if you haven't tried raise your hand if you've done the rollout. I think the rollout is one of the best exercises you can do in the gym. It's simple, but unfortunately is also performed incorrectly on a regular basis. So the traditional rollouts typically performed on a Swiss ball like you see here. And your individual will start. Now, ideally we'd have a little better starting position. He's probably just setting up for this, but in the initiation of the exercise, he should have neutral spine from shoulder to hip to knee, which he does get to in the rollout piece. And all he's doing then is maintaining that neutral spinal position, right? So he might be here and just altering the position of the limbs. Okay, by altering the position of the limbs, you change lever length and you induce much more force in that core region. If you haven't tried this before, it's a very simple and in most ways simple exercise to really challenge especially these the global core muscles, and definitely some of the intrinsic core muscles. Just a couple things to watch for. Here, you don't want to have the hips pike, right? Again, we would like to have a little more of a neutral spine here. The other thing to be cognizant of is that we don't sag the lower back. So as you get tired, typically the core musculature will disengage and the back just sort of sags, or the hips just kind of sag forward. And now we take the load off the right muscles, right? Off of those core muscles we're actually trying to activate. Can be done with a TRX, as you can see here, in a couple of different manners, or a Swiss ball. Or simply, you could actually do this in a plank position with towels or a towel under your elbows and just simply moving the elbows up and down. Right? So if I'm on the ground, right, in a plank position, I don't want to go down because you won't see me, but in a plank position, I simply move the elbows, and you can try one side at a time, going out wide, going out laterally, right? All of these maintaining solid isometric contraction of the core, and we just alter the position of the limbs.
Okay, so the next one in the big three is this is the side bridge, and the side bridge is a fantastic exercise. It really engages quadratus laborum, connects this lower rib to the hip. So this is our bending, right? So basically I can flex, I can extend, I can twist, and I can bend. So we'd like to engage those muscles without flexing, extending, twisting, or bending. So in this case, the side bridge, this is a really great exercise, but we see different techniques being done here. I'm going to show you a few. But basically, the knee is at 90 degrees. This is a modified. And the shoulder is, the elbow is directly underneath the shoulder. If I get the elbow too far away, too much strain on the shoulder. So we always like to keep the elbow nice and tight to the body on there. And what we're looking at here is ear is directly over the shoulder, shoulder directly over the hip, hip directly over the knee. Nice straight line on here. And so again, it's that same descending pyramid. So we hold it, and I'll have Shada demo for that. So she's going to hold a side plank. We go 10 seconds, we relax. We go 10 seconds, we relax. And so in this case, she's got her knees bent at 90 degrees, right? And then she's going to come up, and she wants to make sure her head is back. So usually hips are forward, shoulders are back. And she's going to hold that position 10 seconds and then relax. And then she's going to come back up again. It's hard to do on this because the surface is slick, but she's going to hold it for 10 seconds and then relax. That make sense? So I do 6 of those, relax for 20 seconds, 4, relax for 20 seconds, 2, flip to the other side, and do the same thing on the opposite side on there. So this is a modified. I always tell my students, start with the modified. If you can't do 10 seconds with the modified, don't try to do this. So longer lever, much more challenging exercise. So this is a full side bridge, and in this case, the feet form one point of contact, elbows another. So this is a much longer bridge here, but again, you can see the ear is directly over the shoulder, shoulder directly over the hip, hip directly over the feet. And on the feet, top foot is always in front of the bottom foot. And it's basically the toe of the back foot is touching the heel of the front foot. So you can see down here, this is not what we want to see, and this is usually what I refer to as that sort of a twisted sister position, right? So, and maybe Cheda can demo that. That's where people are more in a piked position. So we see that quite a bit as an attempt to do the plank, but it's not so great. So you can see her upper body is rolled forward, and we don't want that. So we want the upper body back so that her upper shoulder is directly over the lower shoulder. Make sense? Yeah. So we don't like to see that, that body twisted on there here. So this is a really advanced version. This is basically called a roll. So in this case, what we're doing is starting in a side plank position, rolling to a forward plank position, and then rolling to a side plank position. So it's hold for 10 seconds, it's hold for 10 seconds, it's hold for 10 seconds. that is really challenging, right? Great exercise. And what you'll notice is spine is not flexed. Spine is not flexed. Probably like to have his rear end down a little bit more here. And spine is not flexed. So you can see that the musculature is being activated, but the spine is not being flexed or extended, and so there's no strain on the discs. Make sense? All right. So this is a modified plank. So we just showed you some pretty extensive ones. This is a modified plank. So I could do the same thing up against a wall. And that's a really nice way to engage. So again, same thing. My front foot is in front of my bottom foot. Elbow is about even with the shoulder. And I just lean, and that musculature is activated. So I could turn and then turn again. So I can do the same exercise and not get on the floor. Right? So oftentimes a lot of folks enjoy that as well here. So for folks that have shoulder injuries, oftentimes we'll use a leg lift. And in this case, what we're doing is we're not activating psoas. So in this case, what we're using here is, again, you're going to activate the quadratus laborum here. So you can see that she supports herself so she doesn't roll over. But what I really like here is that she's got her head and neck in a neutral position. So she's not doing this. Right? So you want to demo that one for me, Shada? We oftentimes see folks where they'll do this, where they prop their head up, and you can see where now the neck is not in a neutral position. So we like to keep that head down to support the neck so that we are able to lift the legs, and in that case, you'll activate that quadratus laborum. This is a great exercise, really great exercise to do. So some things that will activate the muscle but strain the discs are these exercises.
Yeah, you still see quite a bit of this going on in the gym. I see this just about every day when I'm in the gym, the side bends, weighted side bends. You can see, of course, using cables. Oftentimes with dumbbells, of course, you'll see this sort of activity. But when we add an excess load to this, we're increasing compression. But when you go into what's called lateral flexion like this, we also create some pulling or stretching forces at the disc, at those annular fibers. Okay, and again, with the extra load, now we're increasing the risk of damage at the disc. So an alternative to what we see here is actually, again, to train this or overload this system, but still maintain a neutral spine. And so if we go to the next piece here, you'll see, actually, if you want to go to the next one just for a moment there, Ellen, I really like what we call suitcase carries. Or what you might just consider of in this general group of asymmetrical loading or asymmetrical carrying exercises. So literally we can hold a dumbbell in one hand, and you may not find much stimulus if you're just using a light dumbbell with this. Sometimes it may take a good bit of weight that's literally trying to pull you into lateral flexion, but you're forced to use the musculature on the opposite side, quadratus lumborum, multifidus, the obliques, to maintain that neutral spinal position. And not only is this an effective core exercise, but if you do this well and you use sufficient weight, this can actually become a very good conditioning exercise. Along with that, it's a very functional exercise. Think about how many times do we carry things like this in one hand, right? Carrying luggage, whatever it is. If we can learn to carry things with an upright posture, neutral spine, and still maintain activity in the musculature, we're taking the load off that disc and keeping it within those core muscles that we're really trying to activate. He's using a kettlebell, and again, you're sort of seeing the opposite effects on the contralateral or opposite side of the core. Other activities you might see are overhead carries. So some may do overhead carries, or even just holding a dumbbell here at the shoulder creates a different leverage system, right? Again, pulling us into that opposite position, we have to correct with the musculature on the other side. So again, many ways in which we can tap into these same muscles without putting the disc at risk and doing these side bends, these weighted side bends. So we go back to that previous slide. You'll see sometimes this exercise is called the Pallof press. I think it's just called the lateral cable hold here. We just want to have you guys do this quickly. This is a very simple thing to do, so everybody stand up. And what we'll do, and Ellen and I will demonstrate. I'm just going to hold my hands out, or she'll hold her hands out, and get a nice solid base. We want about shoulder width stance. Brace. So we want to engage the brace. And again, just a little flexion at the hip, right? So load the gluteals a little. Ellen and I can put our hands on either side, and we just push against each other. So find a partner and push against them, then switch sides and try to push in that opposite direction without moving the spine. Now you want to beat up your partner a little. You could just do it, so you do it. You hold there, and I'll just force her around. She's just going to try to stay there without moving. And I'll push her from all directions. But again, the easiest way to do it is we just push against each other and resist. Push and resist. Do you feel it? It didn't take much, right? But you can definitely feel that core engagement.
All right. I've had several students will say to me, suitcase carry, but suitcases have wheels. Yeah, and now they do everything else, right? Now you can have your remote control and they just follow you around like a golf cart. Anyway, so yeah, suitcase carry. Okay, last exercise. These are called bird dogs. These are for the spinal extensors, really important muscle group that gets neglected all the time. So in this particular one, Shada's going to show us how to do it. You're going to start on all fours, and important, hands directly below the shoulders, knees directly below the hips, so she's not elongated in that way, so her base of support is directly underneath the joints. She's going to extend her right arm and left leg simultaneously, and she wants to keep her nose pointing towards the floor. I'm a big believer. Wherever my belly button points, that's where my nose points. So if my belly button's pointing towards the floor, so is that. So she wants to extend the leg, and she wants to make sure that the leg is straight, and what she's going to do is make sure that the ankle parallel to the hip. She wants to make sure that the wrist is parallel to the shoulder, and she wants to keep from teetering back and forth. So she wants to be nice and steady. So she's going to relax, and then she's going to go ahead and go back to that same position. So she's going to extend again, and as she does that, she's going to hold it for 10 seconds, and then she's going to come back in, and then she's going to sweep back out.
Oh. If you drop my phone. So you notice we just use an object like a book or a phone, and we can place it on the lower back, and this can prevent hip shifting. Right? A lot of times this exercise can be easier than it should be because people will simply just shift their hip to the opposite side. But if she's able to maintain a neutral pelvic position here and disallow my phone, and if she drops it again, there goes her grade in anatomy. So it gives her a cue, right? Something to balance there. We can use a water bottle, whatever it may be. But this, again, was going to prevent that pelvic rotation that can sometimes make this exercise a lot easier than it should be.
Yep.
Looks good.
Yeah.
Nice job.
So she would do whole 6 repetitions with the right arm and left leg. Relax for 20 seconds. 4 repetitions, right arm, left leg. Relax for 20 seconds. 2 repetitions, right arm, left leg. Switch to the other side. And do the same thing again on there. So this is a modified. We have people that getting on all fours would be very challenging. So I can also do it using, for example, a table or a brace where I can extend, and I'm going to hold that 10 seconds, 6, 4, 2, same sort of idea here. So easy way to do that same extensor, as Peter's demoing here, easy way to do that same extensor exercise without getting on the floor as well. All right, so just quickly here, the last couple of things here, we'll have you out of here by 8. The last couple of contraindicated. So anybody ever do, now some people call them Supermans. I prefer superhero, a little more gender neutral. All right, so Peter's going to tell you a little bit about these. These are problematic.
So a real issue here, just quickly, is that when we get simultaneous extension of the hip and simultaneous extension of the vertebral column, the vertebrae actually begin to compress or exert more force between one another, and this can actually induce fracture. This can also result in herniation, but can also put undue stress on the other joints of the vertebral column, and again, produce small hairline fractures, and sometimes fractures so significant that the posterior backside of the vertebra actually breaks off. So we have alternatives to this. A great alternative to the superwomans, as I prefer to call them, superwomans, are the bird dog exercise, or is the bird dog exercise, which trains the extensors and forces them into a position where we're alternating one side at a time, so we cannot hyperextend both the hip and the vertebral column simultaneously, right? There's an interplay there. So you're taking the load off the bone in the bird dog and, of course, keeping it on the muscle. Another great exercise. You can pair this with the bird dog, so this will train the gluteals and also put at least some load on the extensors of the vertebral column. But just watch your hyperextension here. That's what most people will tend to do is she's a little hyperextended there. Our guy here has a little better flat or more neutral spine. Good gluteal activity and also training those posterior muscles of the vertebral column without that hyperextension we saw with the superwomans.
So same idea here. Lift and hold 10 seconds. Right, so we're trying to train these muscles for endurance. Great exercise as well. Do any of you use the TRX in the gym? Fantastic exercises. You can do all kinds of things, and you're going to notice neutral spine, neutral spine. So you can do, I like them because it's a 2-for-1. I can work my scapular retractors at the same time I'm working the core. And for me, anytime I get 2 exercises for the time of 1, that's a thumbs up. That's an excellent thumbs up. Peter, anything you want to add on there?
You know, of course, you can diversify this a little bit, but the more inclined you are towards the ground, obviously, the more difficult this gets. So that's what's great about TRX is, of course, you can always modify to make things easier or more difficult as well, but absolutely maintaining that neutral spine throughout. Here's another comparison of 2. Now, some are going to do the Russian twists. All right, that's what we call this exercise, the Russian twist. It's not necessarily one of the best exercises because I see very few people who can actually do this exercise properly. To maintain that seated position he's in with neutral spine is nearly impossible for most. And in fact, they'll get into this position and quickly take on a position of spinal flexion. Now you add a load and you add a twist and you're into the triple threat. You're compressing the spine, you're flexing the spine, and you're twisting the spine, right? Those are the 3 mechanisms or common mechanisms of disc injury. So if you can maintain a neutral spinal posture, this exercise can be effective, right? But again, what is it really? It's really an isometric exercise for the vertebral, for those core muscles, right? You're not moving the vertebral column. You're rotating, yes, but you're not flexing or extending. This is about the worst way you could do it. And of course here, not only does he have his feet locked, which means it becomes a hip flexor dominant exercise, he's in significant flexion, which means this becomes a hip flexor dominant exercise that is degrading his intervertebral discs, right? So young guy, right? But in 10, 20 years, oh, I got a slipped disc. I got a herniated disc. And it may have all started, or at least part of it started with doing poor movement patterns, just like so.
And, you know, in the fitness center, we see people attempting this. In fact, I don't think I've ever seen anyone who actually can perform this exercise with a neutral spine. We see this all the time, and I hope you'll think twice about doing the Russian twist. They're just side bridges, great exercise. All right, I'm going to let you.
All right, we've put it all together and finished this up. And what we see, of course, after all of this, right, in this 2 hours, that was the fastest 2 hours of your life because you had so much fun. Of course, we want to see, of course, protection of the disc. And if we follow some of these basic rules, you can do that, right? Maintaining the neutral spine, exhibiting good posture, translating what you've learned tonight into good exercise technique. So the healthy disc, right, reduces nerve irritation because you can avoid disc herniation. And of course, no nerve irritation, no pain. You can remain active for the rest of your life. Now, again, saying this to 20-year-olds is like saying this to 5-year-olds. It's like, yeah, whatever, right? But these are the things that you need to be cognizant of today, because you may be doing the damage to your discs today that you'll be suffering from when you're 30, 40, 50, or 60 years old. Before you leave this disc, you got to, wait, look at that. Right? That's all Ellen's idea, but you got ideal posture, good exercise technique. You'll have a, wait.
You don't get your time unless you get one last thing here.
A
Hold on
healthy,
1 second.
pain-free back.
All right, so, yes, it went a little longer. The stronger the trunk, the stronger the tree. Have a great evening. Drive safely. You can sign in up at the